So we're going to talk about the suprascapular nerve and the skeletal anatomy of the suprascapular nerve block. To perform this block, it's important to know how the nerve travels into the suprascapular fossa. So it starts from the superior trunk of the brachial plexus, accompanies the omohyoid muscle, goes into the suprascapular notch, comes off the suprascapular notch, supplies to the supraspinatus muscle, then travels through the spinoglenoid notch, comes off the spinoglenoid notch and supplies to the infraspinatus muscle. To perform this block, the ultrasound will be placed on the spine of the scapula. So feel for the spine of the scapula, put the ultrasound probe on the spine of the scapula, and you will move the ultrasound probe up to have the visibility of the suprascapular fossa, and tilting the probe anteriorly, you'll be able to see the suprascapular notch. The important thing to keep in mind here, you do not need to put the needle in the suprascapular notch because you have a thoracic cage in front of you, and if you do not be careful, you will end up giving a pneumothorax to a patient. So it's very important to tilt the probe and look for the bony landmark, the suprascapular fossa. The needle, you can bring the needle out of plane, touching the fossa and injecting the local anesthetic and steroid mixture, or you can bring the needle in plane, coming from medial to lateral and landing into the fossa and injecting the local anesthetic and steroid mixture. The local anesthetic volume would be 4 to 5 mL of local anesthetic and 40 milligrams of depomedrone, or you can also use Kenalog. Going to show you the suprascapular nerve block. To perform this block, patient will be either sitting or in the lateral position. If the patient can touch the opposite shoulder, it's always a safe technique because you're moving the scapula away from the chest wall in order to minimize the pneumothorax. If your patient has a pain in the shoulder and is unable to do that, keep the arm laying on the side with neutral position. The first step would be to feel for the spine of the scapula. The second step would be to lay the ultrasound probe on the spine of the scapula. The spine of the scapula shown on the ultrasound image. And now what I'm going to do is to move up. You're going to increase the depth as well as the gain in order to see the suprascapular fossa. Here we have the suprascapular fossa. I'm going to increase the depth by another centimeter. So you should be able to see the fossa and the other structures. Here we have, I'm going to now just freeze this image and I will show you all the structures. The procedure can be performed either an in-plane technique from lateral to medial, or you can perform an out-of-plane technique. The structures on the ultrasound image here. We have the suprascapular fossa. This is a deep investing layer of the supraspinatus muscle, and we have a trapezius muscle here. You can bring the needle out of plane, going below the investing layer of the supraspinatus muscle, and inject 5 mL of local anesthetic or steroid. You can bring the needle in plane from medial to lateral and target the same area.